Tetrahydrozoline is a type of decongestant that is used to reduce redness in the eyes caused by minor irritations like smog, swimming, dust, or smoke. It is part of a group of drugs called sympathomimetic amines, and it works by temporarily narrowing the blood vessels in the eye. Some eye drops containing tetrahydrozoline may also include lubricants, which can help protect the eyes from further irritation and dryness. This medication is typically used as needed, with 1 to 2 drops in the affected eyes every 4 hours, or as directed by your doctor. It's best to use the eye drops at the first sign of redness or irritation. When using eye drops AC 0.05% to 0.25% ophthalmic decongestants, it's important to follow the directions on the product package or as directed by your doctor. Before applying the eye drops, make sure to wash your hands and avoid touching the dropper tip to prevent contamination. If you wear contact lenses, remember to remove them before using the eye drops and wait at least 10 minutes before reinserting them. Check the eye drop visually before using and do not use it if the liquid has changed color or is cloudy. Keep the medication away from children and pets. You can use this medication in the affected eyes up to 4 times a day as needed or as directed by your doctor. When applying the eye drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Place 1 drop into the pouch and gently close your eyes for 1 to 2 minutes. Try not to blink or rub your eyes. If you need more than 1 drop or if you need to apply the medication to the other eye, repeat these steps. After using the eye drops, do not rinse the dropper and make sure to replace the dropper cap tightly. If you are using other eye medications, wait at least 5 minutes before applying them. It's important to note that overusing this type of medication may result in increased eye redness, so be careful not to use it for longer than 3 to 4 days at a time. If your condition lasts or gets worse after 72 hours, or if you think you may have a serious medical problem, stop using this medication and seek medical help right away. If you experience stinging, redness, widened pupils, or blurred vision, it's important to let your doctor or pharmacist know. However, many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as eye pain, worsening redness, itching or swelling in or around the eyes, or any other vision problems. It's also important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. Always consult your doctor for medical advice about side effects and to report any side effects to the appropriate medical authority in your country. Before using tetrahydrozoline, it's important to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients, such as preservatives like benzalkonium chloride, which can cause allergic reactions or other problems. It's best to talk to your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have glaucoma, heart problems, high blood pressure, diabetes, eye infection or injury, or overactive thyroid. After applying this medication, your vision may become temporarily blurred. It's important not to drive, use machinery, or do any activity that requires clear vision until you can do so safely. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's unknown if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding. When using eye drops AC 0.05% to 0.25% ophthalmic decongestants, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with a healthcare professional before making any changes to your medication routine. If this medication is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek medical help immediately. Symptoms of overdose may include drowsiness, severe sweating, decreased body temperature, and slow/shallow breathing. If you are in the US, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. If you're experiencing symptoms related to allergies, try to stay away from things that may be causing your symptoms, such as pollen, grasses, weeds, dust mites, and pet dander. If your doctor has instructed you to use these eye drops regularly and you happen to miss a dose, use it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and continue with your regular schedule. Avoid doubling the dose to make up for the missed one. Remember to store this medication at room temperature and away from light. Keep it out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless instructed. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.